Hey everybody, it's Dr. Hammerstedt from Holist. I am totally poaching an empty patient room in the emergency department before I head home from a night shift for this Medical Monday. But I wanted to get this done and out there for you guys early, and more importantly, before my little monsters were awake when I got home. So I am super excited to bring to you today sort of a superhero, social hero, entrepreneur, anesthesiologist, mama, academic, and an author, Dr. Marjorie Stiegler, and she is the new co-founder of Transformed Conference, and I am really excited to have her on here to talk about what she does, but more importantly, to let all of our tribes know what we can do for career revitalization. Is it time for you to shift? Is it time for you to move on? What can you do to know when that is? What kind of transferable skills do you have? How do you break that survival mode? And more importantly, how do you reduce your Hi Marjorie, you're here, I'm bringing you on. Reduce your plate so that you can actually accomplish those things. And so I am adding her here. She's going to come on and talk to us about a really exciting new book that she has out, and then we're going to get some learning points. Hi there, welcome.
Hi, can you hear me okay?
Yes, I can. What a beautiful purple wall you have behind you.
Oh, thank you. I have to have my office has to be bright and fun.
Yes, I hear you. And I was just saying before you came on that I am totally poaching an empty patient room before I leave the emergency department, so my ambiance is not quite as nice as usual. But you do
well,
what you gotta
I can see that I have, bright light from the window, and then,
That's great.
Anyway.
Yes. Good morning.
We'll okay.
Thank you so much for joining us. I was just giving a little bit of a introduction to you, and I want to hear your story and your why, so people should know why they should be super stoked to be watching you on this live today.
Well, I don't know if I have any reason why anyone should be stoked to be watching me, but the reason that I've gotten into some of this work that I know you wanted to talk about today is a little bit of accidental knowledge. I mean, I think for many of us, you go through life, you have some experiences, and then much of what I've done or I've achieved was sort of accidental. It wasn't really strategic. But when I look back now, I think it could have been strategic. And had I deployed some of those things strategically earlier, I could have had perhaps more and different success faster. And even if I couldn't for myself, I think it's important for other people, because we're hearing so much, especially this year, about burnout, and not just in medicine, burnout everywhere. And so I think it's really important for people to have ownership of their careers and their lives, and to feel like they do, and not to feel like they're stuck on some kind of a rat race they can't get out of.
Absolutely. So I feel, I know that we feel this profoundly in medicine, that we are on this track from the moment we left college and went into medical school, that we just did whatever it is that we're supposed to do next. And having that kind of light shine where you can look out and be like, oh wait, there are other things that I could be doing, whether it's in medicine or out of medicine, or how can I shift this so it's more important for me and my family, or what do I actually want to do, has been really inspiring for me in my own kind of last year and a half. So tell us just briefly sort of, what you are up to with Transform MD. I'm sure I'm saying that wrong. Transform MD.
Well, we just call it Transformed. That's
perfect.
Okay.
And then touch into what we want to talk about today.
So we just had an internet snafu. I heard nothing after Transformed, but but I could tell you about the conference, which is more limited in scope than our conversation today, because the conference is for physicians only, and it's for women only. It's not necessarily for people who want to make dramatic changes, although it could be for that. We can certainly help with that. But it's sort of a deep introspective dive. I like to think of it as less of a conference and more of some small group coaching. It's podium free, right? There's not going to be a bunch of lectures. It's going to be sort of one on several people doing some group work to really to put that pause button on and really understand what it is that they wish they were living, right? Why they were hoping to, have life that way. And then importantly, how it got away from that, right? Where they are now, what they're doing now, why it's not really aligned with the life they thought they would be living or with their values. You know, as an example, a lot of us would say that we really value dependability. And in medicine, you know, you show up, the patient is first, right? So we were living that value when it comes to work.
Yeah.
But there's a lot of times we're letting down family
Or ourselves.
and not being dependable and really not, or ourselves, absolutely. And then that's really not living that value. So there must be a way to make some tweaks, make some changes. And that's what the conference is all about. And certainly those lessons could be applicable to a lot of folks who can't attend.
Yeah. So I'm going to give a plug, and I'll put this in the comments. There's a really great, very similar sounding conference or training that I went to last year that's not for physicians, that I'll put in for it's the Next Level Women's Leaders, and it's really lovely. It's out here in Idaho, but they do things all around the Northwest, and totally worth flying to. So I'll put it in there. So all right, tell me about breaking survival mode cycle. What is that?
Well, so you know, you already kind of described it. You kind of teed it up. So many people, particularly in medicine, but I think in life, you know, you just get caught up doing the work. You're so caught up doing your own work that you forget to stop and ask yourself if what you're doing now is what you want to be doing.
Yeah.
Where you see yourself later. It sounds kind of cliche, but where are you going to be in a year? Where will you be in 5? Where are you going to be in 10? And what are you doing to get there is often completely lost. And what's even further buried is if you even want to be doing what you're doing at all.
Yeah.
And especially in medicine, it's such a linear and prescribed pathway, right? You know, in college that you've got to do all your pre-med stuff. Then you get into medical school and you work your tail off to get to the right residency. And then you get the residency and you work your tail off. And then you're new faculty or you have your private practice and you want to prove yourself there. And decades, I mean, just evaporate. And then you wake up one day and you think, wait a minute, what, you know, I'm closer to what? Like I've achieved all this stuff for what? For where? And for many people, you're right on track. I don't know. But for me, I started to realize people kept asking me, you know, a decade out in academic practice, you know, did I want to be a program director or a chair of a department? And I thought, wow, like light bulb moment. No, I don't. That's not really anything that was ever an aspiration for me. And so when people said, well, what is, you know, kind of the end game, where do you want to be? That was sort of an aha moment that happened for me. Also right at the time that I had some things going on in my house, you know, with my family. And that
waving to people saying hi to us.
I know, I'm seeing them too. I didn't want to interrupt myself to say hi to people, but thank you guys for coming on. So I think it's really important. And then I had, I don't mind just sharing this, I had sort of an artificial brakes put on my life because my husband got sick. So about 18 months ago or a little less than that, he was diagnosed with cancer. And I had to clear my plate, right? Mm-hmm. I didn't have a choice. I mean, I guess I had a choice, but I knew what the right choice was. So I totally cleared it. And then I had a very long opportunity to decide about what it was I was going to bring back.
What was valuable.
And so that was actually a silver lining. It was very, very valuable to me.
Yeah.
To be able to make that call.
So I feel that survival mode all around me all the time. And it's not necessarily just in medicine. It's not necessarily just in our careers. I think a lot of us are just in that survival mode. So I think a lot of this that we're talking about is not just career revitalization. It's like life revitalization, right? Like, so in my wellness coaching programs, they're 12-week programs. The one that's live right now and is really awesome is our weight program. And the reason why it's so effective is because we're using science and hormones and real food, but we're also using mindset coaching. It's based, you know, with a life coach or a meditation guide or a hypnotherapist to let you shift all those things in your life that are causing that problem for you. And that is something that everyone going through a problem like this in career needs. I mean, we all need someone like that in our back pocket.
Yeah.
Sure.
I mean, people can barely make a to-do list of what they want to accomplish that day, let alone really stop and map out what they hope to accomplish in the long term. And importantly, why they hope to accomplish that. Yeah. Because, you know, I've had many careers, so to speak. You know, I've had an academic career, private practice career. I'm an industry physician. I am a small business owner. I founded a maternity athletic wear company. It has nothing to do with medicine at all. And I do social media strategy for nonprofits. And so a lot of different things. So I guess what I'm I'm teeing that up to say is that just changing your job doesn't change where you are. Right?
Yes.
The grass is not greener just because you get a new job.
Yep.
So when you're starting to think about and you're making space for that pause where you decide what you want to do and you're taking deliberate steps to get out of survival mode, you know, it's really important to get deeply in touch with what your values are and what that means in life. Like how would you know if your life is honoring the values that you have? You know, what types of behaviors would you expect from yourself to know that you're aligned there? Because, you know, taking a shift in direction or even a major jump to a totally different position or job or totally different passion pursuit is not going to land you in a better place if it isn't aligned better with those values, right? It's not about the job.
Yeah, totally. And that's, I mean, the same with anything, right? You get the money that you thought you wanted, the house you thought you wanted, the weight you thought you wanted, the fitness you thought you wanted, right? Like, what is it really, right? If you're not making those shifts. Hey, everybody who's watching, we're super stoked that you guys are here. Please like the video so that we can track you down and make sure that you can see the other ones. So we're talking about the survival mode cycle. My next question is sort of, how do you think people get to that know when to you career shift? Like, how do you know if you're shifting or if you're tweaking like we're talking about, or whether you're doing something kind of way out of what you've been doing before, you know, your maternity company, or, you know, I mean, those kind of things, or you just kind of trudge on? Like, how do you make that decision? And I guess the next question is what's your kind of first step for being able to make those little steps in between the bigger steps? Because that's always, I can always do a 5-year, right? You can always do a 1 year, but like, how do you get to that, you know, bigger picture? Who do you reach out for help for stuff like that?
Yeah, no, that's a great question. So, I mean, I think, first of all, I mean, if you've thought about whether or not you should be in a different career, I think you should listen hard to that. You know, I think that's an important part of intuition. We often have these thoughts and then we just kind of squelch them, but that's not having a bad day. You know, if you're sitting there at some point saying, I wonder if this is really right for me, I wonder if I should be doing something totally different, that's not the result of having a bad day. That's the result of sort of serial things that have, you know, accumulated to have you feel that way. So I would say, first of all, if that's even crossed your mind, you should listen to the voice. Now, how long you kind of trudge along, so many doctors have asked me this question because they're really interested in having, you know, me having successfully had both clinical and non-clinical jobs. And a lot of people are interested in kind of non-clinical routes or even totally non-medical routes because they feel burned out. So again, I'm not sure jumping out of medicine is really the right thing, even if it feels like that's what they want to do. But, you know, you want to ask yourself a few practical questions, right? What is your financial situation and your family obligations? Sometimes that makes a difference in terms of how much freedom you feel you have. And that's why it's so important that people have good financial health. So I'm not an expert in that, but people should be taking care of their financial health. That's really important. And then I would say, you know, when you ask yourself, are you more concerned about what your family thinks or what your friends think? Or not your colleagues, right? Are you more concerned with whether or not your people at home are proud of you or your people at work are proud of you? That can kind of help you know which way you're going.
That. Yeah.
And when you have time off, imagine you had some free moments, you know, what do you spend it thinking about? And do you spend it all thinking about your job? And if so, is that in positive or negative way? So if you think about your job and it's stressing you out when you're not even there, then I think, you know, that's something to strongly listen to. And if you're thinking about it when you're not there and you don't have to be thinking about it, but you're just getting really jazzed and excited about different ideas that you could deploy, I mean, that's really important, right? That shows that you do have some passion there. And then how are your relationships with people? And just your life? Is it getting better? Is it getting worse? So I think asking some questions like that can help you to know whether you really want to shift. But before doing so, I really need to emphasize that backing up and figuring out what it is that's going on in your current role that's making you want to run, because you don't want to run to something that has those same problems.
Yeah. I think a couple other things that I think about too is, you know, asking the people who you value the most who are in your life about what they've seen that's changed about you over the period of time that you've been struggling with that. Because I know at least my closest friends and my spouse are probably the people who know me better than I know myself, and can kind of mirror those things to me. So I think that's really helpful. The other thing that I think about all the time, because I'm really passionate about physician wellness and about creating a bigger more well-rounded health system. And that's the bigger picture of Holist. I'm trying to put together networks of alternative and conventional practitioners into teams to work virtually together around one patient, so we can amplify each other's results, but that we can bring, break down those silos between different doctor groups, between the acupuncturists and the doctors, between whoever all the rivalry is all about, right? And bring the patient into the center. And I think that one of the problems is that we've lost that relationship with each other, and we've lost the patient-physician relationship. And that's a cause of burnout. That's not my fault, right? It's not the physician's fault. We're the most resilient profession. I mean, I'm biased, of course, because I think we're great, but we're like the most resilient. I mean, look what we got through, right? So the fact that we're all suffering from this at this point, I think is just a bigger picture. And I've been calling it that we're canaries in the healthcare system, quite literally dying off because of this. So I think that if you have the opportunity to think about this and start working in your own little community, whether it's your business community or whether it's your teacher community or whether it's your physician community or whatever that is, to figure out what are the systemic things that you might be able to fix, maybe you're going to love your career again, right? I mean, it's worth thinking about in that way.
As you're talking about what you're building, I can just see how excited and passionate you are. That's definitely something that is filling your cup, right? And giving you energy, giving you the resilience to maybe deal with your other day-to-day. I don't know. Mm-hmm. But it also really speaks to the fact that you're right. For people who are feeling burned out in medicine and elsewhere, it's not about you, right? You are not a big failure. There's a lot of things going on in the system, and especially in medicine. The reason that's going on is because physicians have been so busy with their heads down taking care of the patients.
Absolutely.
That we haven't participated in the administration and the way that the hospital leadership and the healthcare leadership has changed, right? So we're not at the table there.
Yeah.
So I know that there seems to be an interesting response. A lot of physicians will feel somehow negatively towards a colleague if they take an administrative role or they take an industry role, and they'll say oh, that person, sold out to whatever position they take. I think that's extraordinarily short-sighted. And we cannot be in charge or influential in that greater scheme if we aren't there.
Yeah,
and
absolutely.
We don't need to all be there, but somebody needs to do it. And for people who have that aptitude and have that interest, I think the rest of us ought to be really supportive.
Absolutely.
Because that's how we make those changes. So if the system is largely the problem, well, we can't just complain about it from the sidelines.
Yeah, which we've done for decades. I really feel like that's changing, though. I mean, I just think about the passion that I see mostly kind of with our social media physician, communities, but also just seeing more people going to the legislature to start to stand up. I mean, I've been doing that for some physician and patient issues, so it's really important. So, so let's see. What about that kind of, how do you break down a bigger time span into smaller to-dos, and what kind of resources do you think people could start looking into to kind of get some information on their own, or seek out, coaching around career change? Or I know you might have an announcement to have on something that you may have authored that might be helpful.
Oh. Yeah, well, those things are a little bit different. So, so I have a book that's recently become available you can buy it on Amazon or possibly in your local bookstore, Barnes & Noble and so on. It's called The Social Prescription, and it's about social media for healthcare leaders. So physicians, administrators, and anybody, all clinicians, and how you can use it to really further your agenda. And your agenda doesn't need to be about you, right? Yes. It could be about your career, your visibility, your promotion ability, connecting with other colleagues to do other kind of work, like connecting with you.
Create that community.
Or it could be things like the Ice Bucket Challenge that raised all that money for ALS, right? It could be using social media platforms or digital platforms to raise awareness for disease and do good for patients. So there's many, many things. That book is available. I hope people will read it and enjoy it. And it does actually help too, I think, describe for people how it is that they can position themselves in order to get opportunities. I mean, the thing everyone always says is it's hard to get your foot in the door, right, for different opportunities. But what I found, and what many of my clients have found, is that we just deploy a couple of simple things online, and the door comes to us. most of the big achievements or the big pivots that I've had in my career came to me. I didn't go, knocking on the door and try to break in. And there's a lot of things you can learn about how to do that. The other thing is, in terms of the small steps that you mentioned, I think it's incredible when you talk to highly trained professionals, lawyers and doctors and people who have spent an extended period of time in training. Mm-hmm. They'll say, I don't know how to do anything else, which is hilarious to me. You're extremely capable and have already demonstrated yourself to be, very able to learn and good under pressure and have, teamwork and leadership and all of these other things. And people will say, I'm not qualified to do anything else, but you are. And so I think sitting down, probably with a coach, if this sounds counterintuitive to you now, then probably with the coach. And especially if you're serious about making changes, it's worth the investment. But to understand what kind of, historical experiences you have and how that translates into other fields and into just generalizable, transferable skills, and how you might write a resume for industry that's, different from an academic CV. Yeah. You are qualified. You're very qualified to do a lot of other things. And so it's just incredible to me. It's almost this negative brainwashing of like, I don't know anything. I'm never quite good enough.
Well, it's because we've been on the train track, right? We've been on that train track. So I know that at Transform's conference, I know that you guys are going to do similar things. I can speak back to the next level women leader training that I did. It's just 2 days in Boise last spring. It came to me sort of at the time that I was open, right? I was ready. And that's when those opportunities come, right? They may have come past you otherwise, like you were talking about.
Yeah.
But one of the things that I found really valuable for that was just going back, literally writing down on Post-it. I'm a little bit crazy about Post-it notes, like writing down on Post-it notes, just stream of conscious about the things that I've accomplished throughout my life that I was most proud of, or felt most successful, or who someone else would have said was I was most successful for, and writing down what I did and how I got there and what kind of personality or tenacity that I had personally that made that happen. And then picking out all the things that were common through that, and then pulling those out on little Post-its and being like, these are the 6 things that I rock at. And these should be the things that I do. And whether that's simple things like authenticity or transparency or, anything like that. And those become kind of what you're good at. Then you can, it's less like I'm a doctor, I'm a dentist, I'm a massage therapist, I'm, whatever it is, it's you, right?
Yeah, absolutely. I mean, as I rattled off when we first started talking, all the kind of different things that I've done, people will say, well, those things are all totally different. And in a way they are really different, but in a way they aren't. I mean, at the core of what I do regarding, medicine and the role that I have now in industry and the social media book and the conference, I feel like what I am is a communicator, an educator. That's the overlying theme there for me. Like I like to connect with people, hear what it is that they're going through and kind of try to work with those things. So yes, I'm a doctor, but I don't think, I'm not just an anesthesiologist, right? I have a lot of skills beyond that. Education is one of the reasons that I stayed in academics. Yeah. But you can teach residents in the operating room and you can give a grand rounds or you can give a big, huge keynote, but there's a lot of other ways in which being able to connect, being able to educate, make complex things simple, look at things in a different way and coach, there's a lot of ways to apply that in many, many different fields. And for me, that's the common thread. If I really zoom out and I think about all the things that I'm doing, I mean, that's really what I'm doing at its core, I suppose. Yeah.
And that's what we're doing right here, right? I mean, we're educating each other, but we're educating the people that are listening, and they can talk to someone else about it. And, it's kind of raising all of our IQs a little bit about what everyone else is up to and how we can improve ourselves and our community. You said something else that I wanted to say something about, and it totally just flew out of my nocturnist post-night shift brain. But it is what it is. So really, really great, really great conversation. I'm really happy to have connected with you like this. Please drop into the comments any resources that you have that you think will be helpful, whether it's your own resources or whether it's things that you've learned from that you think people can learn or research through on their own. And then give us a little bit of a shout right here about your social media handles so that we can follow you in your blog and things like that. So.
Oh, sure. So yeah, I'll do that. I'll put some of the resources that we've talked about into the comments with the links. But yeah, if you want to find me on social media, I'm on Twitter, Facebook, and Instagram, all with the same handle, which is at DRM Stiegler. So STIEGLER, all across all the platforms. And then you can come to my website, which is marjoriestieglermd.com. I'll throw that in there as well. And I do have some free resources on the website, including an ebook, a free ebook on professional branding, and links to all the different stuff that we've been talking about. So I hope that will be helpful for somebody. It's been really a delight to talk to you this morning.
Thank you.
I am so excited to see what you're growing.
Thank you.
So thanks for letting me be part of it.
Yeah, I'm gonna just speak real briefly here before you go, just so everybody knows. I did talk a little bit about the big picture of the integrative care coordination with Holist. You can find us at Holist Health across all of the social media platforms, and then www.holisthealth.com. In the meantime, while I'm building that model, we are having focused programs on specific health needs or health and wellness needs, and that's pulling together, like I said, sort of different practitioners along with coaches and physicians to help you with that. We're doing women's health, we're doing fitness, we're doing kind of a health IQ program, and we're doing a weight program. The current one that just relaunched, which I'm super excited about, is a 12-week weight wellness program. You have a personal coach on weight, and you have a personal coach on mindset, and you get 12 weeks of daily podcast information that I put together on weight science and mindset, and really a step-by-step way of using real food and to get your hormones back to where you need to be, with a lot of help from a lot of really awesome people. So I will put a link to that in the comments as well. And it was great talking to you. I hope you have a lovely Medical Monday. I'm going to go home and rouse some kids out of bed out here on Mountain Time and eat breakfast and head to bed. So.
Oh my gosh, have a good sleep.
All right,
I'm
take
gonna go
care.
to work.
Thanks everybody for watching. Bye-bye.